Hi guys, well it is the first day after my hair transplant. I slept last night with one of these travel pillow to sort of obviously protect the donor area from the pillow or the bed, which I think I did. All seems okay. Waking up the next day, I've had a real good look at what I've had done, and I have to say I've seen pictures and videos of some other people who've had it done, and mine seems quite clean and quite precise and well done. It may scab over a bit more over the coming days. I was going to make this my last video, but I think I'll probably do maybe one a week to keep you up to date with how it's going. If you're interested, if you sort of subscribe to my channel, I'll give you a nudge when there's a new video, and you can just have a very quick look. You don't have to watch the whole thing, but it might be interesting to see actually a week on, 2 weeks on, 3-4 weeks on, how much hair does grow, so you can see it in real time. Anyway, as I said, you get quite a lot of medication when you leave in your debrief. Here's the back. It was more than I thought, to be honest with you. All of this stuff, it comes free where I was at the hair doctor. I would imagine that every clinic gives this to you free when you leave, I would guess. So I'm not going to bore you with all the names and all the rest of it. I'm not very good with medication names, to be honest, but 4 of these a day. 8 of these a day. 8 of these a day. They're antibiotics. 4 of these a day. 3 of these a day. And then, remember I told you about the Paprika pills? You've got to have 1 a day for the rest of your life. That's those there. You don't have to have them for the rest of your life. I did a bit more research last night. They recommend you have it for at least the first year to really see the effects. But if you want to stop your hair falling out, that's what you do. You have 1 a day for the rest of your life. They've also given me some special shampoo. So I'm on day 1 after procedure. On day 3, you can wash gently with lukewarm water. The same for days 4 and 5. And on the 6th day, so for me that would be a Saturday, a week after I've had it done, you can use this special shampoo. Got to use this, nothing else. And you use that bottle until it runs out. And then you can go back to your original shampoo. By the way, I use that black bottle, red top, caffeine formula stuff, and the hair doctor told me that was actually quite good to use for your hair. It's quite a genuinely good one, so pleased about that. And then after you've washed your hair, when you've got some back, you use minoxidil, which is like a little liquid. You put it on your hands and you rub it in, and it kind of helps the growth and the thickness and all the rest of it. And the only other thing I've got is a spare bandage. I don't need that. It was just in case the one I'm wearing got really manky and bloody or fell off or something. This I can take off tonight before bed, so you have it on for 2 days after you leave the clinic, and then when I take this off, that's it. So take this off. There's nothing else on my head. I'm not allowed to touch it or put anything on it for 2 weeks. I'm also not allowed to create sweat on my head because the sweat bead will push the follicles out. What a shame. No laborious work. What a shame. Can't go to the gym. So I'm going to actually, they say 2 weeks, but I'm going to give up the gym just for a month, just to be sure. And then it's Christmas, so probably be 2 months. Anyway, so there we are. So it's looking, for me, I don't know how you feel about it, it's looking pretty clean and tidy for me. Pretty tight, pretty happy with it. Well, I'm very happy with it. I'm looking forward to seeing... the weird thing is, I'm saying this, you don't know what the result's going to be like until the hair grows back. But it's feeling good. It's feeling right anyway. So listen, I'll keep updating on this. I'll only do 1 a week. So if you subscribe, you can see in real time what your hair looks like when it starts to grow back. And if you want to see it, great. If you're thinking about having your hair done, I think I'd be more than happy to answer any questions, by the way. If you want to, I'm not some guru, but I've been through it. So if you want to ask someone what it's like, especially a clinic up north, because that's where I've got mine done, then do ask sort of thing, and I'll tell you any answers that I can. Oh, by the way, one thing I forgot to mention, there's this like therapist guy as part of the clinic. He's not part of the hair doctor. Well, he works with hair transplant clinics all over the country, and the hair doctor obviously uses him, but he's available, I think, at lots of clinics, and he talks you through the processes. He's had a transplant done himself. I think he was losing his hair and it really affected him badly. It affected his psyche, changed his personality, low self-esteem, felt awful about it. So he had his hair done, and as I'm a bit chilled out about it, but lots of people don't freak out about it, but they're asking loads of questions. Oh, they want to know what's going on. Oh my God, what does this mean? So he's there to answer any questions and kind of listen to your thoughts and feelings, and essentially therapy, kind of therapizes you through the journey. So so I was given his name and number. I think it's free to ring him up and have a chat. I don't know for sure. So I thought that was quite good as well. And who knows, maybe in a week from now I'll be thinking, oh my God, what's going on? I need to speak to somebody about this who's been through the same thing, and I'll call him. I think his name was Dylan, didn't get his second name. So anyway, so that's that really. So listen, I'll do one video a week. Do say subscribe if you want to see how it goes. The reason I've got this hair transplant is all part of my life goal to wake up on my 40th birthday looking and feeling my best. I know I don't look it, but I'm 40 in April. So I'm also going to get teeth whitening, personal training sessions, Botox, tan, and everything else. I might put the whole lot on there. But you just heard the doorbell. That's my Domino's pizza that's just arrived. Well, I'm recovering. So I will see you soon. Bye.